Okay, hi everyone, and welcome to today's sessions of Healthy Discussions. Before we get started, I just have a few housekeeping notes. The chat box and Q&A feature are both open, so please feel free to use them. You can turn on subtitles, which are auto-generated by clicking the CC button on the bottom left corner of your screen. And this session is being recorded and will be posted to Quality of Care NL's YouTube channel. I'd like to acknowledge that we are joining you from the ancestral territory of the Beothuk, and that the lands on which Memorial University's campuses are situated are in the traditional territories of diverse Indigenous groups. We acknowledge with respect the histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province. We invite everyone to offer land or territorial acknowledgements in the chat and to take a moment to reflect not only on why we offer these acknowledgements, but also ways your life and work may contribute to decolonization and reconciliation. So for those who aren't familiar with Quality of Care NL, we are a research and evaluation program based at Memorial University aimed at improving social and health outcomes in our province. Healthy Discussions is a webinar series where we have quality conversations about health, healthcare, and social systems in Newfoundland and Labrador. Our goal is to engage with you on these topics with the aim of continuing public conversations during the ongoing process of health transformation in our province. Public discussion also contributes to the growth of a learning, health, and social system in Newfoundland and Labrador. On the screen right now, you can see a definition of a learning, health, and social system as defined by Health Accord NL in its task force report. This definition might seem complicated the first time you read it, but what it really boils down to is health and social system that continuously improves through a culture of best practice, evaluation, equity, openness, and collaboration. The system learns and gets better, resulting in better care and health for all. Part of the definition states that individuals and families are active participants in all elements. By engaging in sessions like this one, by being an active participant in your own health care and wellness, by talking about and acting on issues that impact us as a society, you are contributing to the learning, health, and social system in our province. Today, our discussion will focus on low-value care in the health system, and we are delighted to have us joining us Dr. Wendy Levinson, Chair of Choosing Wisely Canada. Joining Wendy for today's discussion in the Choosing Wisely NL is Choosing Wisely NL Provincial Coordinator, Krista Mahoney. Krista has some questions to get our conversation started, but we will be taking questions from the audience. So please type your questions in the Q&A box, which is a little bit easier for us to manage. Sometimes questions get lost in the chat as people chime in with their own thoughts. Since today's discussion is being recorded, you may wish to ask your questions anonymously, which you can do by using the Q&A instead of the chat. So without further ado, I'm going to pass it over to Krista and Wendy to start today's conversation.
Thank you, Robert. And I'd just like to thank Wendy for kindly joining us again. She's been so supportive. I'm going to ask her a few questions to get things started, but as Robert mentioned, if people want to chime in with questions along the way, that would be great as well. So Wendy, when it comes to our own personal health care, we often think that more is better, that more care means better care. But is that true? Can you explain what's meant by less but better in terms of healthcare?
Great. Hi, everybody. It's a pleasure to be here. I'm very supportive of your work in Newfoundland, Labrador. So this is a great opportunity for me. So, often when we go to the doctor or your nurse practitioner or someone, you might think, well, I want to get a prescription, or I think I need an x-ray. And, you might even wonder, if they don't do that, well, are they giving you good care? Because people can equate good care with getting things like x-rays and laboratory tests and prescriptions. But we know that many things are actually not helpful and can even be harmful. So let me give you a few examples. If you get a drug and you don't really need it, like an antibiotic when you really have a cold, you can get a bad reaction to that antibiotic. No, not everyone will, but some people might, and that is the side effect that you get even if you didn't really need the drug. And we build antibiotic resistance when we use antibiotics we don't need. And yet we know many people, Krista, get antibiotics when really it's a viral infection. So that's an example where less but better. I'll give you another example that's a little bit difficult to understand, but is important. And that is that sometimes when you have a test, like an X-ray, they will find something that's there, but it's not relevant. It's what we call incidental. And then you get another test to explore, why is that thing there? And then another test and another test. And we said that's a kind of a cascade of tests, which mean you need to take time off work and have more and more testing just to pursue something which really wasn't needed in the first place. And that's very common with X-rays, like a chest X-ray or an MRI for back pain. So I always say to people, look, you need a test when you need it, or a treatment, but you don't want them when you don't need it, because they can even be harmful. So that's the basic concept.
Okay.
Does that make sense, Krista?
Yes, perfectly. All right, so I don't see any other questions coming in, so I'm just going to move on here. For those of us who are unfamiliar, could you please explain what Choosing Wisely Canada is?
Yeah. So because of this concept, and every doctor, every provider, nurse, everybody knows this concept that really more is not always better. In fact, less can be better. We realized that we needed to raise the profile of that concept. That overuse of unnecessary or low value tests and treatments was not often talked about. So in medicine, for example, I'm a physician. We often encourage trainees to, we say, leave no stone unturned, do tests to rule out everything. And we reward that. But in fact, what we know is true is that what I explained before, that you should use tests and treatments more carefully, more judiciously. And so we started to build a campaign 10 years ago in Canada to really change the culture. And so Choosing Wisely is a campaign that was designed to encourage conversations between patients and their doctors and nurses and other health professionals about unnecessary tests and treatments, and encourage people like you on the phone to ask questions about whether I really need this or I don't. And so it began that way. And now we really, as it spread over the last 10 years and people know more about Choosing Wisely, we kind of hope to be the national voice for reducing unnecessary care in Canada. And I might add, just to the question you asked me earlier, Krista, we can talk more about this in the conversation, but these concepts of reducing unnecessary or low value care are better for patients, but they're also better for our healthcare system, and actually also better for the climate. So we've tried through the campaign to have recognition of the concepts that less but better, and encourage these conversations in many contexts, including this one today.
Great. I think you've already started to allude to this, but what can we as patients do? What are some questions we can ask our healthcare provider?
Yeah, this is a really important question, and we encourage people, and I'd love to hear from you, like, have you ever asked these kinds of questions? We encourage people to ask 4 questions. Do I really need this test or this treatment? What are the downsides, so that you can understand what complications there could be? What are the other options? And what if I just don't do anything at this moment? So, you can ask that about a test, or you can ask about treatment. Do I really need this? What are the downsides? Are there simpler, safer options? And what if I don't do anything? And I would be interested if you want to put in the chat your responses to this. I think sometimes people feel, well, I don't know, I shouldn't question my doctor or my nurse, or, they're the experts. So, that maybe it's not right to ask these questions. But I think that's a culture that's changing in medicine, and we really encourage shared decisions, that a physician might know what medically is appropriate, but patients have their own values and priorities. And so, really, you're the expert in what's best for you. And because there's often more than one option, it really is a shared decision. And I think it's very important for patients to feel that they can ask these questions of their provider. Um, so, I'd be interested in whether, you might think about this. Often parents can ask these questions for their kids, but I think the concept that decisions made in medicine, in medical care, are shared is very, very important. I don't know, Krista, have you ever asked your doctor those kinds of questions?
Yeah, I think probably more so in recent years, I maybe think more about, even, do I need to make a doctor's appointment over this issue or whatever it is. I'm probably more inclined to think about in my own life. Would it change management if I went to a physician or not? Or is there someone else besides a physician that I should be, like, do you need massage therapy or some other treatment, rather than immediately going to that doctor's appointment? Robert, did you want to field any questions from the?
Well, there's no questions right now, but I just kind of wanted to add on to this conversation is that the province, our province right now, is kind of moving in that direction where they're allowing patients to be more into the driver's seat of their own healthcare. I mean, one of our previous healthy discussions conversations was around a new application that NLHS and government have released called My Health NL, which is an application that allows patients to look at their test results and prescriptions. And this provides information to the patient before getting follow-ups with their physician. And this is a very new concept, and it allows them to give themselves more education and ask questions to their healthcare providers of these tests, what these tests mean, and whether or not they need more tests.
I see also there's a comment in the chat box that we are just as much in charge of our health as our healthcare provider. And I think that's really accurate. You need expertise from someone who knows medical information, but how you use it and that you engage with the health profession, it really is a shared endeavor. And I think that's a shift from the past. I mean, in my parents' generation, I think there was this doctors knows best kind of view of the world. And I think, just like Robert said, many provinces across Canada have shifted, and, I can get my records online, I can see my laboratory tests, and I can feel like I might not understand all those things and need to ask questions, but I own that information. There's a saying about nothing about me without me. Nothing about me without me. Because that transparency about the healthcare system, I think, is very healthy and encourages this as a, sharing our health together.
Yes, it goes hand in hand with our patient-oriented research approach, of course. Okay, so earlier you mentioned that the benefits of reducing low-value care go beyond the patient to also benefit the system. So how can decreasing low-value care make an impact in this area?
This is a really important question. I'm sure everybody who's participating in this call has had the experience or knows someone who's had to wait for an X-ray or a procedure. And we have a healthcare system that is trying to care for a population of patients. And as you know, in a population with increasing chronic disease and aging, and so there's pressure on our system. And we don't have we have to use our resources wisely. So let me give you an example.
Yep.
A lot of times people with low back pain think that they need an X-ray, an MRI. Well, the basis of choosing wisely, and I probably should have mentioned this earlier, Krista, is that we work with the national societies, the Canadian radiologists, the family doctors, other health professionals, dentists and pharmacists, and each of them have created a list of 5 or more tests or treatments in their discipline for which there is excellent scientific evidence of overuse or harm to patients. So I'll give you the example that family medicine and other specialties have a recommendation that says don't do imaging for low back pain unless, quote, red flags are present. So that means from the history or physical, the provider thinks that there may be something more serious going on, and then it's indicated. But much low back pain really is not helped by looking at an X-ray. In fact, it can cause the problems I talked about earlier. So we have all these recommendations. So if you don't do an X-ray when there are no red flags present, that's better for the patient because they don't have to wait for an X-ray, go get the X-ray, and then risk these, quote, incidental findings. But it's also, Krista, better for our healthcare system because we have a limited number of MRI machines, and there are cancer patients and other patients who really need those imaging procedures, and they can have trouble getting in because there's a line, there's a wait in many Canadian provinces. And so if we do the imaging when it's needed, but avoid it when it's not, it's both better for the patient and better for our healthcare system because we can then be delivering the care that is needed for the patients, like the cancer patient that needs to get in. Does that make sense, Krista? Is that clear? I mean, it's not the reason to not do it. I want to underscore, if I'm with the patient and they need an X-ray, then I'm going to order the X-ray. I'm not trying to avoid ordering an X-ray when it's needed. But I think collectively, if we are thoughtful about when we use our resources and avoid it when it's not needed, we create capacity in our system so that we get to take care of the population of patients and each individual patient. I mean, what, Robert and Krista, what's your reaction to that? Thinking, the Newfoundland context. I mean, what's right there?
Well, yes. I mean, it goes against basically the fact that we want to reduce low value care so that the right treatment gets to the right patient at the right time.
Yeah, I think we all hope that when we really need care, that we can get it in a timely manner. It's not going to be bottlenecked with unnecessary tests that are being done. So it benefits everyone for when they really need it, right?
And so, Wendy, I got a few questions coming from the audience there, but before I get to them, can you kind of just allude perhaps to the fact that maybe if there, the fact of a false positive coming in on tests and how that could affect the trajectory or the care pathway of a patient?
Yeah, so let me do it with an example. Let's say there's a case of a woman in her late 60s who needs a hip replacement. And she's been waiting a while for the hip replacement, but she's perfectly healthy with no diseases. And then she goes to the hospital and they do some, quote, preoperative tests, and they do a chest X-ray. And on the chest X-ray, they find a little, she's a low risk patient, but they do a chest X-ray and they find a little something on her chest X-ray, a little bump in her chest X-ray, or nodule, what we would call a nodule. And these are common and they're often benign, but because she has that, she then has a CT scan to look more detailed at her chest. And then they're still not certain, so the radiologist recommends a needle biopsy where they put a needle in and get a piece of tissue. Fine. And then they have to wait for the results of that tissue biopsy. Plus, it's a little uncomfortable to do this. And by now, it's 6 weeks later, and her surgery has been delayed. It all turns out to be benign because it was what Robert called a false positive. Yes, there was something on the x-ray, but the x-ray wasn't needed in the first place. And so when you do tests, you will often find things which are what we call incidental or a false positive. And so this woman has had her surgery delayed for a significant period of time, had to keep going back to the hospital, a procedure, some anxiety about what it is, all for something that wasn't needed. So that's what's meant by a false positive.
Thank you. So I got a question here from Andy. Is there anything related to planning to reduce or eliminate the long-term use of drugs? For example, statins.
Yeah, so that's a great question. Um, Drugs are really at the top of the list of things that when you don't need them, you don't want them. Especially in older people. You know, there are a lot of seniors in our population who end up on, many drugs, 10 drugs. We call it polypharmacy. So in choosing wisely, I mentioned that we have these recommendations. There are about 600 recommendations of things we shouldn't do. And that includes a third of them or more are drugs, just as you suggested, Andy. And, many of these drugs, so often statins get started and they get continued forever. A person might be in their 80s on a statin to prevent heart disease. Well, at a certain point, one should stop the statin because it isn't providing any added benefit. Like if you're 85 or 90, you don't need to be on a statin. And so the concept of thinking about whether drugs are needed and stopping when they're not needed is a very core concept in choosing wisely. And like I said, many of the recommendations are about drugs, some for acute drugs like antibiotics, but others, these chronic drugs like statins. And, one of the efforts that we've been concerned about is the use of antipsychotic drugs in long-term care. So often people get put on an antipsychotic to kind of manage their behavior if they're a little bit agitated. And we know they do more harm than good in older people. And particularly during the COVID pandemic, the use of our antipsychotics in long-term care went up, and it's quite high in people who don't need them. So that's another example in the long-term care setting of a drug class of drugs that we really want to try and curb because they do more harm than good.
Yeah, and another one that we've in Newfoundland that we've kept an eye on and evaluated is the long-term use of proton pump inhibitors or PPIs, which is there's a lot of chronic use within our province. I have one more question before I pass it back.
Can I
Sorry?
give you one more example?
Yep.
So, I'll give you another example. Maybe this pertains to some of you on the phone. Sedative hypnotics, sedatives, basically like benzodiazepines. We call them benzos, but these are all the groups used for sleep. So we know from data, and all of our work is data driven, just like it is in Newfoundland. We know that 1 in 12 Canadians over 65 is chronically using a sedative. And I can tell you from a lot of research, these do quite a bit more harm than good. They lead to falls, confusion, memory loss. They're a drug group that we really, there's great evidence that older people should not be using them chronically. And in fact, I have to say there's a lot of variation across the country. And in some provinces, including Newfoundland, the use of these are higher than other parts of the country. So that's another area of focus for choosing wisely. And if any of you are on the phone that are taking sedatives every night, you might want to talk to your practitioner about trying to taper off them.
I got one more question here, Wendy, before I pass it back over to you, Krista. It comes from Andy again. And does the movement towards wellness prescriptions, or what we're calling social prescriptions, like nutrition, exercise, or community events, to replace medication, does that fit into this sort of topic, or the choosing wisely mantra?
Yes, absolutely. I mean, I really applaud the work in Newfoundland to think of this as more of a health, part of healthy conversations. So absolutely. I'll give you an example again. We when doctors often give out antibiotic prescriptions, someone comes in, my kid was up all night with an earache, I need antibiotics. We encourage clinicians to give what we call a viral prescription. Your child has otitis media, that's the name for earache. And the best things to do are take uh, medications, over-the-counter medications like acetaminophen or Tylenol, drink a lot of fluids, and rest. And call back if in 5 days this is not improved. That would be an example of a viral prescription. But also you could have prescriptions for exercise or just the things that you're talking about, which really are important ways of patients taking charge of their own health, the thing we talked about earlier. So absolutely, trying to decrease the medical things and using healthy ways to improve your health are very much part of choosing wisely.
Yeah, and we saw that throughout the health accord as well, that there's this focus on the social determinants of health. We know that that makes up about 60% of our health outcomes, where only 25% comes from the delivery of care from the healthcare system.
Yeah, that's a very important point that Krista brought up, and might surprise people on the phone, that such a high proportion of our health outcomes depends on these factors: diet, exercise, good living conditions, education. So our health is really embedded in a much broader context in our life. It's not just about seeing the healthcare professionals.
The next question shifts gears a little bit. The Health Science Center here in St. John's was recently designated as a Choosing Wisely hospital. What does that mean, and will other sites get designated in the future?
So maybe I can answer this and you can answer this too, Krista. Let me explain the concept and then you can talk about the Newfoundland experience. We've encouraged hospitals to really engage in choosing wisely. Why hospitals? Because a lot of things we do in the hospital become kind of routine. People get admitted and we order a panel of tests and treatments. Sometimes a patient, and if you've been in the hospital, you might know, you get poked every day for blood to repeat these blood tests. And yet we know that they're not necessary and they're uncomfortable. They wake people up at 2 a.m. or whatever. And so we know the hospital is a place that does a lot of things that don't add value, and that these are just sort of, I could say, baked in. Nobody really orders them, they just seem to happen because they're part of the routine. And so we created a program for hospitals to engage in choosing wisely by picking a topic that they know they do routinely, that they might be able to change, that's low value, studying what their rates are at the moment, then doing something to improve it, and then measuring again. And if hospitals do that on a number of topics and send us the data to show their improvement, they can be designated a Choosing Wisely hospital. And I'm delighted to say that one of your major hospitals has done that. And we're hoping that Choosing Wisely Newfoundland Labrador can help spread that across your province. So Krista, why don't you tell them a little bit about the designated hospital there and what they did?
Sure. So at the Health Science Center, we enrolled in 2 of the national programs, using Blood Wisely and using Labs Wisely. So that refers to efforts that were done around reducing unnecessary lab tests, and also reducing unnecessary blood transfusions. So those are, we have several sites across the province that are enrolled in those two programs. At the health science, there's been several other initiatives, one of which we used in our application process was on known as Drop the Pre-Op, which was reducing unnecessary preoperative tests. So before someone goes in for a surgery, it might be a surgery on their ankle, and traditionally maybe they would have received a full panel of screening tests, including chest x-rays and a bunch of blood tests, and do a pre-op visit. And we've learned that many of those are unnecessary, and they can lead to the identification of these incidental findings, the unnecessary exposure to radiation from the chest x-ray, and so on. So we rolled out a toolkit designed by Choosing Wisely Canada, where we reduced some of these preoperative tests, and we demonstrated that over several years, and submitted that data to Choosing Wisely Canada to receive this designation. And much of this work has been done at some other sites as well. So we're now just trying to gather our thoughts and see where to start next. But there's about 13 hospitals across the province that are on our radar for designation over the next few years.
Yeah, I might comment here, and I know you have a question, Robert, but Newfoundland and Labrador's really done a great job of implementing some of the Choosing Wisely recommendations. In fact, if I had to pick of a province across Canada that's really at the forefront, Newfoundland would be one of the two most accomplished provinces in starting to roll this out. That doesn't mean there's not more work to be done, but yes, I agree with Robert. You know, you've done a really great job, and we see you as leaders.
Thank you so much, Wendy.
I got a question there, Krista, and yeah, I'll add on to that, Wendy, that it takes those clinical champions and leaders that gave that initiative to get behind those that like, for instance, the Choosing Wisely Hospital. It took great leadership within NLHS and provincial government to do such things. So I have a question from Nicole. Given the finite resources available for healthcare, there is a focus on demonstrating efficient and effective use of healthcare resources and showcasing that we are delivering high-value care for the money we are spending. Can you speak to opportunities for defining value for money? And just before you answer that, Wendy, like the value for money is sort of an aim in which what we call within the quintuple aim.
Yes.
And for us, trying to implement the learning health system, that quintuple aim is the outcomes in which we're trying to achieve. And obviously the value for money is a big part of it. And obviously Choosing Wisely has a huge sort of piece in there.
So, you know, I would just say it's important for me to say we do frame Choosing Wisely as having a primary goal of improving the quality of care for patients. So all of these recommendations, they really have a focus on quality. But at the same time, we know that efficiency is very important, as you've mentioned in the question. So let me go back to an example that Krista used of blood. I bet many people on the phone have been blood donors. And, you know, blood is a precious resource because we donate it. And then it has to be processed, and you have to match it to the patient. You have to hang the blood. There's a lot of nursing time. There's side effects with blood. 1 in 100 people get a reaction to it that's quite important. And lastly, and we can come back to talking about this, there is a lot of plastic that's just about used in delivering a unit of blood. So, you know, and blood is costly. Canada spends $1 billion a year on blood. The Canadian Blood Services, that's their price tag for blood. So we know that that many of these transfusions of what we call red blood cells, a part of the blood, are not needed. It's a little bit a habit. I learned to practice medicine by always ordering 2 units of blood. And we have a whole program called Why Give 2 When 1 Will Do? Because really the best evidence shows, and there's a lot of research, that you can give one and then reassess whether a patient needs a second one, and frequently they don't. So what I'm explaining to you is here's a precious resource, very expensive to purchase, very expensive in human resources to deliver the blood. There's side effects, and we're overusing it. And why do we overuse it? It's just how we practice. And so it's hard to change those practice patterns. But if we do, using the example of blood, think what we have to gain. We protect a precious resource. We protect the patient. We decrease costs. I mean, actually huge cost reductions if we cut into how much blood we use that's not needed. And lastly, we can come back later to talking about protecting the planet. So we say less, but better. And one of those big less is financial. It's not the reason we created the campaign, but it is an important thing as we roll it out at a population level. Robert, does that answer the question?
Yeah, absolutely. I have one more question before we go back to Krista. And this perhaps could be for both of us, really, is do you publish benchmarks for hospitals?
Yeah, that's a great question. So I'll just use the blood one quickly. What we did when we rolled out this big Canada-wide program called Using Blood Wisely is we worked with the experts in blood across the country, and we established 2 benchmarks, one related to using only 1 unit instead of 2 that I mentioned before, and another related to the absolute level of hemoglobin, our blood level where a transfusion is indicated. And so these were benchmarks that were created by the community. Similarly, in using labs wisely, we know certain laboratory tests are just really overused, not needed in the hospital. And so we created sort of a benchmark for reducing these. So we have tried with the community to create these benchmarks. We're working on one right now on the use of antipsychotics in long-term care. But Robert and Krista, why don't you talk about what you did at your hospital?
Well, I'll add on to the using labs wisely because I've seen these dashboards before, and what the great thing about it is that these dashboards will compare hospitals who are within the program of using labs wisely and compare it to other hospitals across the country. So you can see where you are on a lot of these laboratory tests, whether it's decoupling or the overuse of these lab tests, and how you compare to the rest of Canada, which is pretty neat.
Yeah, I think, I just say we call this feedback, right? Often hospitals practice how they practice, and they have no idea that they're using something a lot more than another hospital. Because how do we know that? We don't really share that information. So as part of using labs wisely, we have this community of practice where hospitals get data and then they talk to one another. Hey, how do you guys do that? We're not like that. Like, how did you accomplish that? And then that stimulates a conversation, and it's the learning community, the learning health system that you talked about right at the beginning, Robert and Krista, how you hope to improve the system by learning from others in the province, others across the country who might be accomplishing something that would be applicable to.
Right. And Andy, just for anything within a local context, I mean, you can check out practice points on our website, qualitycarenl.ca, and we've evaluated a lot of different interventions within the acute care center across the province. A lot of it mostly perhaps alludes to the eastern zone, but there is some information that is province-wide. So
Yeah, I want to applaud Newfoundland again here because you guys are great at measuring. If you don't measure it, you can't improve it because you don't know where you are. So I think it's a really great thing to measure and improve and measure again. That's the process of quality improvement.
Right, the iterative cycle. Yeah, I was going to mention the same thing as Robert, that many of our projects that we take on, that we publish in our Practice Points journal, we use high national data to compare whenever we can to see how we're doing against the rest of the country. and also the work that Choosing Wisely Canada has done in collaboration with the Canadian Drug Agency to create minimal intervals for retesting, so commonly reordered tests. They sort of established benchmarks for the time frames for when they should be reordered if it was a normal test or if the person did show disease. So things like the hemoglobin A1C, how frequently it's acceptable to reorder those.
And Christy used a lot of terms there that might be shocking. So let me just reframe. What she just said is, some tests shouldn't be ordered too frequently because they don't change often enough. So trying to help the community figure out how often should something be ordered so it's not ordered too frequently. And that's part of the Using Labs Wisely program.
Thank you, Wendy. Yeah, we've had responses before saying that we should hold up a jargon sign saying stop using jargon because it's not applicable to everybody. Sorry about that.
That's okay. We all do it.
Okay, I'm going to move forward to the last few questions here. We've discussed how low-value care impacts the patient and the system, but many don't realize the immense environmental impact of the healthcare system. Could you speak to the benefits of this work to the environment?
Yeah, this is newer work for Choosing Wisely. It might surprise you as it surprised me to learn that over 5% of all the carbon emissions in Canada come from the healthcare system. So the healthcare system itself is contributing to the problem. And that, by the way, is more than the airline industry. To me, that was shocking because, of course, I thought the airline industry was highly polluting, but healthcare itself is polluting through the buildings and the energy, the waste we create, the plastics. So if everything we do, if not everything we do is necessary, and we reduce it, we can benefit the planet in addition to benefiting the patient and the healthcare system. Because all the things we use, all the plastics, all the materials, all the equipment, all the drugs, they all have to be manufactured, with ingredients, transported across the country, and then they get thrown out. So I'll give you a little example. In the intensive care unit, on average, we use 100 pairs of gloves per day per patient. 100 pairs of gloves. And those, of course, are manufactured and they're plastic, they're rubber, and then they're thrown away in landfill. So we had started a program in Choosing Wisely where we went back to the national societies that created these recommendations like don't do imaging for low back pain or don't use antibiotics for a viral infection, and said, would you make a recommendation related to the environment? And that's very recent. We just launched that in May, but we have 50 recommendations already and more coming in that are on these kinds of topics. So a few examples, like don't do an in-person visit to tell someone that they have normal laboratory results. Do a virtual visit if it's acceptable to the patient. I think that's a great thing that we learned over the last number of years during the pandemic. We didn't want to have face-to-face. We got the benefit of virtual care. So we have if you do a virtual visit, you save the inconvenience, the transportation, and the cost, and the time off work. I have a virtual visit with my doctor on Thursday, and that's just great. I'm actually out of the city. So, virtual visits. Another might be related to these gloves in the ICU. There's a whole campaign called Gloves Off in the UK to try and decrease the use of gloves. We have a lot in the operating room where there's a lot of waste. A third of the waste in a hospital comes from the operating room, and there are many things that can be done. For example, many hospitals still use paper gowns and paper linens, but in fact, if you use recycled ones, it's better for the environment, even if you take into account the need to sterilize them. So we have all these recommendations that now are on the Choosing Wisely website about the added benefit, or we call it the co-benefit, the added on benefit of protecting the planet in addition to protecting the patient and the healthcare system.
Thanks, Wendy. Yeah, I think you've already answered the next question we had here was how can health professionals help mitigate our impact on the environment? So I think the climate conscious recommendations on the Choosing Wisely website really do detail specifically by specialty how each type of healthcare professional can make those choices.
Yeah, let me just say a little more about this. I mean, as a healthcare professional, we see the consequences of climate change on our patients. I mean, everyone there knows about heat domes and fires and the air pollution and the effect that the warming of our planet is having on us. So that we all know. But I think it's sometimes hard to say, well, what can I do about such a big problem? Can we as an individual do something? And so this was our effort to try and help health professionals see that in my own daily practice, there's some simple things I can do. And, sometimes people say, well, will they make a difference? And it's a good question, would it make a difference? But, I think most of us recycle at home. We don't know if it really makes a difference, but it's part of the norm for us now that we recycle. And so I guess the similar question is, well, what about at work? Can we do simple things at work, which, are just a small individual item, but collectively we could try and have an impact. And I think this is very new concept in healthcare. Many health professionals really haven't thought about these before. We're just starting to learn. And we see it, like I said, as a co-benefit of choosing wisely.
Absolutely. Robert, is there any questions from the audience about the discussions around the climate conscious recommendations?
No, it was kind of timely. I had someone write me in the private chat room to just asking if curious if Choosing Wisely had any initiatives or takes on climate change considerations in the account of any of its programming. Now they allude to that the anesthetic gases, so perhaps we can have a quick conversation about what's happening within the province and some of the recommendations around the use of certain desflurane.
Yeah, maybe I can start it and then you can talk about the province, and then I'd like to make another comment. So just to frame for people, one of the things that there are two things you might know about that are quite polluting in the environment. One is not something that's very patient facing, but there's a drug used in anesthesia called desflurane, and it's a very potent greenhouse gas, meaning it is very polluting. And in fact, in the United Kingdom, it accounts for 3% of all the carbon emissions from healthcare. So there is a huge interest in anesthesia and the Canadian Anesthesia Society in getting rid of this drug and replacing it with another equally effective but not polluting drug called sevoflurane, or there are others. And so there's been a lot of interest in working on this. And I think Newfoundland, again, hats off. So Robert, or Krista, why don't you tell them what you've been doing?
Sure. Yeah, this gas came to our attention about a year ago, and we looked into what was happening in Newfoundland. Is it being used here? And we saw that it is still readily being used, but it's declining. So we spoke to some anesthesiologists, and they said, we are very much aware of the harms, of the environmental harms of this gas. So we just they were willing to work with us, and we had buy-in from the chiefs of anesthesia across the province in all 5 zones. So we did a lot of digging to ensure that this was the right route. We did a lot of back work, and then determined that this was the right decision for Newfoundland to stop purchasing it. So we wrote a joint statement with them, which we're hoping is going to be released shortly, to say that we we've jointly agreed to stop ordering it because there's a safer alternative that's clinically similar in its outcome. So we don't need it here anymore.
And you've used the name make desflurane disappear.
Yeah, we're sort of piggybacking off these catchy titles that Choosing Wisely can uses, and try to sort of brand it that way so that it's a catchy title.
Maybe I can give the audience one more example, and then there's a comment I'd like to make. So often people have asthma or chronic obstructive pulmonary disease, COPD, use inhalers. And some of these inhalers are also quite toxic, where they're called meter dose inhalers, where there's an alternative which uses dry powder that is not as polluting. And so one of the some of the recommendations in Choosing Wisely on this topic are about reducing the use of these meter dose inhalers and replacing them with dry powder. And so that is another set of recommendations on a very frequent, common topic that you might hear about, or if you or yourself have asthma or COPD, you might inquire about. And then I just want to make a bit of a comment here because there's some conversation in the chat box. Choosing Wisely started in the United States actually 12 years ago. I brought it to Canada 10 years ago where we started, and we've made a lot of progress. But it's very interesting to learn that it's now in about 35 countries or more in the world, including Japan. And we have a colleague, Shinzo Koizumi, who's on the phone, much to my surprise, because it must be the middle of the night there, who runs the Choosing Wisely Japan campaign. And it's spread, even though like our healthcare systems in Canada, the US, Germany, all over Europe, South America, are so different from one another. But this issue of overuse of unnecessary tests and treatments, it is universal. We all know in every country that we give too many antibiotics for a viral infection when they don't work, or we do too much imaging. And so, and this environmental issue is also resonating, as you can see in the chat box in Japan. So I'm delighted that Shinzo could join us, but I also want to tell the audience, this is sort of an interesting thing that's happening. It's spreading around the world. And just like we can compare areas of Canada to one another, there's now opportunities through the Organization for Economic Cooperation and Development, called the OECD, that reports on indicators of quality in different countries and has incorporated some of Choosing Wisely into being able to compare how we're doing across different countries, so that we can again say, oh, well, this country's doing better than we are in Canada. How can we learn from them? And what are they doing differently? Because patients are basically patients. We're not all that different from one another, even though we may live in a different country. So just a really interesting thing that's happening, might be of interest to you.
I'm happy to say that now Healthy Discussions is now a global webinar based on our audience from Japan. So that's great news. But Wendy, just a quick question. Do you have an idea or a rough idea of how many countries are engaged with this Choosing Wisely?
Yeah, it's probably 35 to 40 now. You know, many of the Scandinavian countries, European countries, Japan, Australia, New Zealand had campaigns, although sometimes they disappear depending on sort of what happens politically in a country. Many of the Latin and South American countries, Colombia has a very robust campaign, Argentina, Chile, and we try to meet once a year to try and learn from one another, just the same concept, so we can make our work better by borrowing things we hear from another country. So it's been spreading really by word of mouth. No one's trying to, it's just a voluntary spreading.
It's wonderful. Thank you, Wendy. I have one last question. I guess we'll just clue up with this. what else can patients do to make sure they make good choices in their care? Sort of a general question, I guess.
Yeah, I mean, I think that, this kind of effort to think of it, as we said earlier, as our health is our responsibility along with our healthcare providers. And to feel that asking questions is part of what you do. I think that is really important. And, to feel that you can question things, do I really need this or don't? I think these 4 questions really are helpful. Do I really need this test or treatment? Are there simpler, safer options? Are there downsides to this treatment? And what if I do nothing? And so I encourage you all to ask those questions, to feel empowered to do that, to think about the broader context, like we talked about, the exercise and diet and healthy living as part of your health. And so I think those are key, and it is shared. Our health is a shared endeavor, and then we also share it as a community. We trying to think about how do we make the healthcare delivery system in Newfoundland as effective and efficient as it can be, so you can deliver the highest quality care to the most number of people.
Absolutely. It's great
Yeah.
advice for me. Sorry, Robert.
Yeah, and hopefully the choosing wisely. We're trying to build up momentum here now, Wendy, because as you know, we're in the sort of a transition phase post health accord, and now we've gone under one regional health authority. So we're trying to push this sort of agenda across the province and in Labrador as well. So that's probably a good way to end things right now, and I'm looking at the time. So that concludes the time we have for today's session. I want to thank Wendy and Krista for leading us through a great discussion so we can all be more informed about this important topic. And so a big thank you to everyone who joined us online. And I know, Wendy, you're in a different part of North America right now, so I'm guessing it's pretty early for you. So a big thank you to you, and a big thanks for this initiative.
I'm very happy to do it, and I applaud Newfoundland Labrador. You are making good progress, and we will learn from you across the country. So thank you so much, and thanks to everybody for joining the conversation. Bye for
Thanks,
now.
everyone. Bye now.
Thanks, everyone.